Allergies, itchy eyes or skin, cold or sore throat, tummy trouble, aches and pains? Think pharmacy first. Your local pharmacy is your expert NHS health team treating a wide range of common illnesses and health concerns with no need to visit your GP. Remember, always keep a well-stocked medicine cabinet and order repeat prescriptions in plenty of time. Find your local pharmacy at nhs.uk/findapharmacy. NHS, here to help.
This is the North East and North Cumbria Providers Podcast, highlighting the fantastic work taking place across the region to provide the highest quality of care.
Hi, and welcome to another episode of the Providers Podcast. I'm your host, Harry Newhouse, and I'm the communications support for the North East and North Cumbria Provider Collaborative. On today's episode, we're joined by consultant radiologist Naail and Zuhir and lead research radiographer Clare Moody, who both work at the Newcastle upon Tyne Hospital's NHS Foundation Trust. Naail and Clare are part of the North East and North Cumbria Imaging Academy. The Academy is supported by the Provider Collaborative and has been set up in the North East and North Cumbria to help improve and facilitate radiology training across the region. So let's welcome Naail and Clare to discuss this further. How are you both?
I'm good, thanks, Harry.
I'm very good, thank you very much.
We'll start with yourself, Naail. Please could you introduce yourself and give us a brief overview of your career so far within the NHS?
I'm Naail and Zuhir. I'm a consultant radiologist. I'm a head and neck radiologist by trade, and I work in two trusts, Newcastle and Northumbria Healthcare Foundation Trust. I also happen to be the training program director for the School of Radiology for Quality, and I am the Northern Radiology Academy lead, which is part of the School of Radiology in the North East and North Cumbria, and I also happen to be the clinical lead for the North East and North Cumbria Imaging Academy. My work into radiology is a bit of a long-winded sort of path. I finished my medical degree originally in Iraq, Baghdad, and I moved in to the United Kingdom, and I did initially surgical training, and then I saw the light and I decided to join radiology as a career. I did my initial work in sort of London and east of England, and then I moved into the northeast, and I haven't regretted that move ever, and I'm still working as a consultant radiologist in the northeast after to finish my training here in the Northern School of Radiology. That is my path that led me here.
And the same question to you, Clare.
So I'm Clare Moody. I'm the regional lead research radiographer for the Imaging Academy and the lead research radiographer for Newcastle Hospitals. So I'm originally from North Lincolnshire. I first got interested in radiography as a student. I went on a work experience at Scunthorpe General Hospital in their radiology department. Loved it, loved science, loved working with people, and I thought, how can I kind of combine both of those? And that turned out to be radiography. So I did a radiography degree at Leeds University, which led me to work for Hull Royal Infirmary for the first year after I graduated, and then moved up to Newcastle in the year 2000. So I've been working for Newcastle Hospitals now for 25 years, so quite an old timer compared to some here. I expanded my role into becoming a dedicated research radiographer in 2011, and then I became the lead research radiographer about 5 years ago. So I now manage an amazing team of research radiographers and a research data manager. And last year, I went on secondment, and I'm now working for the Imaging Academy. So 50% of my role is working for the North East and North Cumbria Imaging Academy, and 50% working for Newcastle Hospitals. And very proudly, in 2017, I worked for the Department of Health for their Nuclear Medicine RSAC Society. So I'm the only non-medic on that committee, and I'm currently serving my third and final term, because you're not allowed to serve any more than 3 terms. So that's nice, and I get well supported within my role in radiography, presenting locally and nationally at conferences and study days. So it's a great career pathway to choose.
Now, you lead the North East and North Cumbria Imaging Academy. Please could you tell us a bit about it?
So I think the Imaging Academy is a very sort of interesting, and it's a completely new and innovative sort of approach to training for imaging, especially for the multi-professional workforce. I think the idea behind it's an adaptive approach to training, and that is pretty much sort of led with what we sort of need in the workforce within the region. And that has been heavily sort of led and influenced by what we needed from the imaging network, and that's what part of where we sit in the sort of the provider collaborative within the region. And so the objectives at the academy every year, although being the general ones, are going to be about increasing the training capacity in general, and then providing sort of skill mix, multi-professional approach to training, and provide that sort of flexible and high quality training across the region, making sure that all the pockets of good training are being shared among the region in a very equitable way, which will then lead to equitable access to training within the region. But that is like the main objective, the blanket sort of wider objective of the academy. But I think like every year our objectives are quite dynamic, and that has been sort of led by the workforce needs that we have in the region, and that adapts with that. So that's what it is in a nutshell. I think the sort of the principle that there is no building and there is no place for it is a bit unusual, I would probably say. But I think that's one of its strengths, because we have a very wide area in the northeast and North Cumbria that, spans from the west coast to the east coast, and then all the way up to the sort of the north of the border in East Scotland, and then near down to South Yorkshire. So if you have a place to sit and put everything there, that makes it very tricky to have that access across the region. So actually, a lot of people would find it very weird that we don't have a building. But I think it's actually quite good that we don't have the building, because we can provide that equitable sort of training and access in the region.
Yeah, I agree. It is difficult when you first come into the academy. People are like, "Oh, where's your academy based?" And you're like, everywhere and anywhere, wherever anyone needs us, that's where we're based that day, and we just go where the need is for us.
Yeah, and then like a lot of the good work that we've done in the academy, like from our academy members, are actually, most of it is outreach, going out to trusts and having sort of local events that will be sort of attended by the locals. I mean, Claire, you've done a lot of these things that we're probably going to talk about later on in the podcast. But Claire did a lot of that amazing work where she went out sort of outreach to the trust rather than bringing everyone into a single place, which doesn't work out for everyone. You can imagine the nightmare of getting time off to go and sit somewhere when you will have that closer to you. It's a bit more accessible and a bit more equitable, and I think that's part of the things that I'm proud about.
What's involved in leading the academy?
So the challenge of that role is actually reflective on the wide multi-professional workforce that we have in radiology, with really different training pathways and different sort of training bodies and accreditation bodies, and trying to work through that as a consultant radiologist is very, very challenging. But that's why we have sort of experts into that field. Like we got Claire here, who's expert in research, and she got a very good track record of that. So for me, as long as I am sort of giving the wider picture of where we need to be in the academy and leaving the experts like Claire or Maggie, or a nurse, or Havina, or reporting radiographer, to actually deliver that part where they are the experts in and they know the right connections with the right individuals in their accreditation programs or the educational institutes, it would work a lot better. So that's where it is. And I think to start from the beginning, so because I was the lead for the Northern Radiology Academy, and we had a very good track record of increasing our radiology doctor of the resident workforce by utilizing an academy hybrid model of training, we took on that experience and we worked very collaboratively with the imaging network from the outset to try and adapt that model to work for the multi-professional workforce in the region and expand that. And my journey from 2022, when I was the only person into the academy. And
This
now
has
we've
grown
got,
so much now since then in just a short period of time, hasn't it?
Exactly. I mean, it's insane to think within 2 years we went in from one person to now 7, I think, which is very
Amazing.
fascinating.
Good a credit to you as a leader to be able to facilitate that.
But without the imaging network and without that collaborative work with them, I would think we wouldn't be here and we would be having that discussion about the academy, I think. So a lot of credit goes to the imaging network to support and sort of help push that vision
And
forward.
helped us with collaborations as well with higher education institutes like the universities that we collaborate with the National Institute of Health Research, and the just different networks. It's been really good having a big supportive network.
Please could you give us a couple of examples of some of the projects the Academy has been working on?
A big project that we've been working on is seeing what the workforce want in terms of radiology research, radiology training. So there's not any radiology-led research that's been done in our region, and I wanted to find out what the barriers were to this. So I did a workforce survey. We got 149 responses out of all of the 8 trusts within our area, which was fantastic that everyone was getting engaged. And finding out the barriers were funding and time and education. So looking further into that and delving deep was finding out what kind of education did our workforce need in terms of research to understand it further, and how did they want that delivered. So we found out and broke that down, and now I know I've got a research and development plan that I formulated on the back of that, and I know what the workforce want and how we as an imaging academy can deliver what they want, going through to them and meeting them in person and doing like little drop-in sessions at each of the trusts, or doing online webinars, or just like little short recorded bite-sized learning that people can access. And we've got an NHS Futures page for the Imaging Academy, and that's got a separate page for research, a separate page for nursing and reporting radiography. So you can go onto them, find out all the information about all the different specialties, and there's a fantastic forum we've got on there as well that we want people to interact with us. It's a safe space to ask any question that you might feel is stupid. Isn't. Everyone else has got the same question on the lips. So that's a big project that I've been working on.
Yeah. And also, like, I think another part of what Clare is doing in the region, which is quite good, is to like reach out to the research and development sort of departments in different trusts and try and understand where the barriers about imaging and radiology engaging with regional or national research, or even starting new research, and working collaboratively with the research and development departments to try and overcome these along with the local radiology departments and try and break these barriers and work with that. The other bit of good work that happened, Maggie Williams, our senior nurse in practice education in the academy, she worked quite hard to try and sort of work collaboratively with a provider that will train in safe sedation within the UK, and they were doing that course outside the region. And travel for the workforce outside the region is expensive. Trying to get the study leave and the budget for it to fund that is a bit challenging. So Maggie worked really hard to try and get a version of that course run locally, and it was done in Sunderland last month, and that worked quite well. It was very well received.
There's a good turnout for that as well, wasn't there? Because it was local and people could go into it and they didn't have to travel and spend overnight somewhere and spend a lot of money. There was a really good turnout for the event.
And even you would think we will have it closer to people who live up north, then it will be a lot easier than travelling down south for it. So I think that was actually something quite good and benefited the region. And the other thing is, like Havina Williams, our reported radiographer, amazingly, within her first 3 months of starting this role in January, she delivered a very, very good sort of webinar, which was not open locally, but it was open up on a sort of a regional level that goes to the neighbouring regions, so anyone can attend it. And it was about interpreting sort of X-rays, and that was received quite well with a very good feedback. And even that session was recorded and is uploaded on our Futures website for people to watch. And we are doing, as Claire alluded to, earlier, a lot of bite-sized sort of professional development type material that are easy for people to look at during their lunchtime or something, because it's very challenging to meet these sort of CPD goals with the limited amount of time that people have. And I think that in the future it will be a bit more and more of that. It's just we are working closely and slowly but surely towards that. We have employed recently, provisionally, 2 sonographers, which I think they will be a great addition to the team when they will be fully in place. And we are going to look at addressing the sonography workforce training needs in the region with that role.
Yeah, it's great. We're looking at all the different training needs that we need in lots of different specialties within radiology, and either delivering them in person at individual trust levels or individual hospital levels, and also providing the online content that people can access at any time they like Naail says. If you get a spare hour study leave, or if you get your lunch hour and you just want to dip in for 10 minutes and watch a little podcast or a little bite-sized learning, then it's going to be there on our NHS Future site.
And with all this work going on, what do you think, since the setup of the Academy, has been the main successes and challenges that you faced?
Few challenges. My main challenge with research was finding out who was the person to go to in each of their trusts for radiology research, because it's not a job role that's given to people in all of the trusts. It's some trusts that it's just kind of a job role that's evolved with certain people, but they've already got an overburdened job role as it is. So it was very hard to kind of dig down and find out who I go to in each trust in radiology to support research. So we've now built a good database up of who's who. So that's really good that we can share with the region. So if someone wants to collaborate, someone from Gateshead wants to collaborate with someone from North Cumbria, we now know who the best person to speak to is. So that's a really good network to set up. And also different hospitals, we've always been different trusts, a sense of competitiveness and working in silos. So trying to break that and work as more regional, a bit of regional equity of learning, and that's what this academy is all about. Not working in your silos, but sharing your strengths and your weaknesses, and sharing learning is what enhances everybody.
And for me, it's exactly what Claire said, but I'm going to put another layer on it where the challenges of actually training the wide multi-professional workforce, I probably touched on that a bit earlier, but that is really, really challenging from our end in the academy, because if it was something straightforward where you were training a single person to do a single task that you can measure quite successfully, that will be a very easy thing to implement. But when you have different sort of members of the imaging workforce, that includes radiographers, sonographers, allied healthcare professionals, nurses, doctors, and even scientists, and trying to sort of comprehensively get a package that will fit each and every member of that workforce is very challenging. But that's when getting people who are experts into that role and engaging with the right healthcare, health education institutions and providers, and course providers and other people who are dealing with the training for those specific subgroups of the workforce would make it achievable and doable. And we are working there slowly but surely, but it's one of the challenges to try and address that. And I think the other challenge is the wide geographic area that we have here in the northeast.
It's a very big area for our Imaging Academy to cover, isn't it? I think we cover the most geographical area compared to any other Imaging Academy. So that is difficult. Yeah. One of the successes we had from nursing was Maggie was able to relaunch the network meetings, the regional network meetings that they weren't facilitated for a while. So that's something that she's been involved in and created a bit more of a regional unity of the nurses. So that was a really good project for Maggie.
And from our end, really, one of the biggest successes is Havina has been able to actually deliver physical content for the workforce and go on these fantastic outreach sort of training sessions into each trust. Was a fantastic thing to do within her first 3 months. And the other thing is probably Maggie's work to try and have some structure into the sort of the wider nursing educational framework that we have in the region and try and come up with a unified plan for that will sort of promote equity and access of equitable training to the nursing and the allied health care professionals that work with nursing in IR and radiology in general.
Yeah, and Maggie's been engaging with Sunderland University with the student nurses, trying to embed things right from the beginning, from being a student, and then you can carry that through your career pathway.
Claire, you're the lead research radiographer for the Academy. What's involved with that?
We always have to look towards research. It drives forward patient care and innovative techniques. And without research, there'd be no cancer treatments, no new joint replacements, no enhanced patient experiences. So we're always looking at the Imaging Academy of how to help radiographers do research in their day-to-day job. We're asking them to look around and find something in your day-to-day job that you're not too happy with or you know could be done better, and then that can be made into a research project. So looking at ways to reduce radiation doses, for example, comparing MRI images to CT images. An MRI scanner uses magnets to get images of your body, whereas a CT scanner uses a small amount of radiation. So looking at those techniques and seeing if MRI could be used instead of CT. We're looking at patient care and less invasive techniques like using CT imaging, CT colonography instead of the colonography that's invasive and that uses a camera to look at your colon. And the Imaging Academy want to drive research forward and get the radiology workforce to work together and to look outside of radiology, because you might be interested in cardiac CT. So therefore you might want to interact with the cardiology team, not just looking into radiology, but start your idea within radiology and then get other teams and collaboration from other teams in your trust and throughout the region. We're trying to get people to pool their strengths and weaknesses and resources. So there might be somebody from Carlisle that's interested and that's really good at statistics, and someone in radiology at Newcastle that's really good on patient care, and someone else that's really good on another aspect. And we get 2 or 3 different trusts pooling the resources and working together, and then it's not such a time burden on one trust. You're all putting a little bit of time and all of your strengths together and creating a really good regional project that's got more of a regional impact than just one trust working in one silo on their own.
And it's actually quite interesting, Claire, when you talk about these, because I mean sometimes it's a bit frustrating when you have like people working on projects in like different pockets. They might be actually working towards the same thing, but
Yes.
because that link is not there, and you are just physically duplicating work or creating work that is going to have a larger impact if it will have a bigger sort of sample or a bigger cohort, and that sort of idea of sharing that good work in between different and open up these communication channels would actually lead to better research, I think.
Yeah, so as I've been doing the drop-in sessions at each of the trusts, I've been getting the workforce to just write in 1 or 2 words the area that they're most interested in doing some research, and we're creating a database that we can start pooling people together, because like Naail said, there's no point duplicating work and doing work that someone else has already done. We've also got a page on the research section of NHS Futures where people can publicise the work that they've done. So I've got a couple of people so far hoping to build that up as soon as we can with different publications that's done by the radiology workforce. So you can see what's being done in the area, and it kind of makes you want to do more research if you find out what's being done and you go, I can do that, or I can do that better, or I can do something similar to that. And that's what we want to kind of engage the workforce and get them excited about doing things.
And you mentioned the workforce there. How does the Academy benefit staff and also patients?
Training and education, us being able to bring training to them. We're listening to what kind of training they want, and we're delivering it in the way that they want, whether they want it face-to-face, whether they want it on an online webinar over a lunchtime period. Just to be able to do that at individual hospital levels, like we've visited the community diagnostic hubs, just to see what they want and if there's anything that we can do as research-wise. I've visited them. And just being able to just deliver what the workforce want when they want it.
I think that is basically the idea behind equitable access to training in the region, and if an equitable access to expertise of training in the region, so both ways, I think. And that will lead to more equitable training, and that's by proxy going to lead to more equitable patient care in the region when we are sharing all that sort of excellent education and training material within the region, I would think. And that is what's going to drive better patient outcomes by proxy. So while we do not have direct impact on patient care, but I would love to think by indirectly we are improving patient care via that route.
Brilliant. That brings us to the end of this episode. Thank you very much, Naail and Clare, for joining me today.
Thanks, Harry.
Thank you, Harry. Thank you.
Thanks for joining us for this episode of the Providers Podcast. Hit subscribe to keep up to date with the latest news and catch up with what we've been up to on our website and social media pages.